Dr. Sarah here with 901 PT, and we're going to go over how to release the hip. So we're going to use a ball to do this, so you can get a faster release ball. You can also do this with a foam roll if you have it, although a ball seems to kind of work a little bit better. You want it to be a little soft and squishy, so a lot of times, especially to get the hip flexor to release, we're going to take the ball and even kind of work up into the abdomen there. So if you use a really hard ball, sometimes that can be too uncomfortable and it can be really hard to tolerate, and being in a lot of pain here is not the goal. So we want to work on a little soft kind of squishy ball here. To hit the hip flexor, we're going to target even right in the front of the hip, and coming up into the abdomen, about at the height of the belly button. So what I'm going to do is I'm going to start with it on my hip, right there at the top of the hip, but kind of where that bony point seems to kind of come through. A lot of times even you'll be tender through here, so you can just work on kind of rolling back and forth over that area. When you find a tender spot, just like when we worked on releasing the quad, you can work on bending and straightening the knee. That can help things to relax as well. To hit the hip flexor a little bit higher, you can move the ball up or roll the ball up. So now it's on my abdomen. Approximately, if I'm working on hip point to belly button, about halfway in between. So working on then seeing if I can kind of put pressure to this area. A lot of times this is very sensitive here, so it can be really difficult to relax. I find that even just having a position where you can let your head relax, or supporting your head, can really help just kind of the tension in the body let go here a little bit. And from here, we're going to primarily use breath as the mobilization. So you're going to work on taking a deep belly breath in and deep breath out. And we want to really focus on trying to let the body sink into the ball as we take that deep breath out. And a lot of times we'll find it might take a minute or two, but you might be able to relax down a little bit further the longer you stay here. So we can work on taking deep breaths in that position to help the hip flexor relax. And then we can focus on the outside of the hip by getting ourselves kind of supported and then letting the ball kind of roll in and out along the muscles and kind of up and down. Once I hit that tender spot, I can focus on just trying to see if I can let the leg relax. I can add little isometric contractions here, pushing down into the floor with my heel so that I'm engaging in my glute, engaging in my hamstring, and then let it relax and see if I can let that muscle let go just a little bit more. So contractions can be really helpful here to help let that muscle let go. Push down into the floor with my heel and relax. So give those a try and see if they help with hip recovery.